Hi, this is Dr. Kashyap with Gallery Women's Health. Welcome to our Journey to Health educational series. Today we have Dr. Ferra Lin-Duffy with us. Thank you for your time and spending some time with us and educating us.
Thank you for having me.
Dr. Duffy she's a breast specialist. She has done fellowship in breast surgical oncology, and she works with Comprehensive Cancer Center of Nevada. So I have actually so many questions to ask you, because I see women starting from age 12 to 104,
Right.
and screening is one of the main things which we do.
Mm-hmm.
So tell me, what is the appropriate age to start breast cancer screening?
Right. So if there's no significant family history, typically we recommend start mammogram at age 40,
Okay.
and it's yearly.
Okay. And are there women who are at higher risk and needs to be started early?
If there's family history, especially if it's first degree family history,
Okay.
that with young diagnosis like age 20s or 30s, then
Okay.
they should have increased in earlier screening.
Okay. And what about genetic testing?
Yeah, so if they have, if a patient has a diagnosis of cancer younger age of 45, or if they have two first-degree relatives, or a certain type of breast cancer, then genetic testing is recommended.
Okay. And a lot of time people think that it is the family history of breast cancer on mother's side. Is that true, or it doesn't matter whether it is mother or father, it's equally at high risk?
Both are significant, high risk.
Both are significant. Okay. And mammograms, as I'm sure you see that also, a lot of women have this report like dense breast on mammogram.
Right.
So what does that mean?
Yeah, so dense tissue means that we have more glandular and fibrous tissue in the breast. So breasts are composed of three kind of tissue. There's glandular tissue, fibrous tissue, and fatty tissue. So when we grow older, our breast gets replaced by fatty tissue, and that's less dense. So when there are more dense tissue, that means that on the mammogram it looks more white, and it's harder for the radiologist to pick up anything small, and that's why they say that it has decreased the sensitivity with dense breast tissue.
Okay. So do they need then more testing, like MRI, routinely? Or?
So it kind of depends on their other risk factors, but there's risk model calculator that can calculate their lifetime risk, and if they have higher risk, then yes, MRI will be recommended. Some people with dense breast, they might be able to do screening ultrasound on top of screening mammogram.
Okay.
Ultrasound doesn't really replace mammogram because they pick up different kinds of things.
Okay.
Mammogram will try to use it to pick up calcifications, which we cannot really pick up on the ultrasound.
I'm so glad you answered that, because I hear it so many times. They're like, because mammograms are painful, so instead of mammogram, can you order breast ultrasound? So thank you.
Yeah. So
basically in breast ultrasound, we cannot pick a lot of things, and so it's important to do mammograms.
Correct.
So,
yes.
and I see a lot of women, especially younger girls, with breast pain. So can you tell us something about that?
Sure. So breast pain, there's cyclic pain with their menstrual cycles, and there's also non-cyclic pain, just get pain once in a while. Our breasts are very sensitive to different kind of things like diet, like with caffeine, hormone changes, there's musculoskeletal, sometimes our muscle pain underneath actually come out as breast pain. And as soon as pain goes away and it's kind of generalized area, we don't have to worry about it too much.
Okay.
The kind of pain that we worry a little bit more will be like it's a focal pain in one spot, and there's a lump underneath or some skin changes, and pain does not go away, and that's the kind of pain that we worry about more.
And I think with breast cancer, the problem is a lot of times, they can have a lump, but sometimes when it's so small that they can't even feel it, or it can be silent, right? So
Yes,
that's why.
they can, absolutely, and that's why we recommend mammogram every year, just so we can pick up stuff so small that cannot be palpated.
And are there any other signs and symptoms that women need to be aware of?
Sure. So once a month, we inspect the breasts and look into the mirror, and if there's any like dimpling in the skin or any abnormal thickening of the skin, any change in color, then that will be something that you talk to your doctor about. And that's for the most part. If you can see any changes, that's something that we do keep in mind.
Okay. And I think also like any blood from the nipples, so that's
Yep, absolutely. Any discharge, discharge, either clear or bloody, that would be something that especially comes off from just one side, not from expressing it. That's something that we would worry about too.
Okay. And so, we send out a lot of patients for pretty much everyone age 40 and above for mammogram. And when they come back abnormal or when they need biopsy, then we all, either I tell them get it from the diagnostic center or prefer sending them to a specialist because then they can get a lot more information. Can you tell me what is the process, like once a patient has a referral to see a breast specialist, because they have there's a lot of anxiety as to what is going on. So
if the biopsy can be scheduled before coming to my office, that will be better because once I have that pathology information, I can provide more ways to treat this thing or what else we need to do, especially if their biopsy can be done sooner than I can do it in office. If it's a mammogram guided biopsy, called stereotactic biopsy, then I cannot do it in office, so the radiology place will have to do it.
Okay. And I know you also do surgeries for breast cancer, right?
Yes.
Okay.
Yeah. From cancer to non-cancerous lesions.
Okay.
Yes.
Well, that was a lot of really good information. Thank you so much.
Thank you.
So if you are experiencing any symptoms like breast pain or a lump or any nipple discharge, then do reach out to us. Or even if you don't have anything, then it is extremely important to get mammogram done. And I always feel that, we are actually fortunate. We live in times where a lot of these things can be screened even before they have time to actually develop more. They can be screened and be treated early.
Absolutely.
So it's important, get it done. And thank you so much again for your time and for educating us.
Thank you.